Hello, welcome to another post from Dr. Blake's Healing Soul. This is a Ask the Podiatrist segment number 2, and today we're answering the question, how do I strengthen my posterior tibial tendon? The posterior tibial tendon attaches or starts way up in the back of the tibia and goes down the leg, going around the inside ankle bone called the medial malleolus, and then attaches into a bone called the navicular. In some patients, that navicular is very prominent and can be called the extra or secondary ankle bone. And then from there, the tendon goes up, down into the arch and helps support the arch. So the functions of the posterior tib tendon are to support the arch and also to invert and plantar flex or extend the ankle. So it has two major functions that when treating the patient we have to be concerned about. So here we're going to demonstrate initially how to do a active range of motion. So here's the rules. So the strengthening exercises that we're going to show are active range of motion, then isometric, then progressive resistant exercises, then functional exercises. It should be done in that order. Should be done in the evening. Should be done so that you can ice afterwards. You should minimize the pain, but sometimes it hurts and you have to sort of see how the day after goes to see if you've done any irritation to the tissue, because there's a big nerve that runs with it. So, but those are the general rules. So we're going to start with just active range of motion. There's no resistance. You line up the foot in a plantar flex position. The tibia lines up with the second toe. That's neutral. And from that point, you're going to invert your foot. And you're going to build up to doing 25 of these. So you're going to point. So we don't want to do it with the anterior tib tendon. Here's the anterior tib tendon, which loves to help. But if that's helping, then we're not really strengthening our posterior tib tendon. So we have our foot pointed, and we do what we call a windshield wiper type exercise, where we're moving the tendon against the air. So no strong resistance at all. And we're going to build up to do 25 of those. Okay. Once you can do 25 very well, then you're going to do the same exercise but against the invisible object called gravity. So Pat's going to cross her leg. She's going to keep her foot plantar flexed, and from that position she's going to invert or abduct her foot. So here she's pulling in, making sure her anterior tib tendon does not come up. That's really crucial that you don't let that try to help you, because we really want to, if we're going to spend this effort, we want to really strengthen that posterior tib. So this is much harder than doing it without gravity. So you're pulling up against it, and again you're going to stop if pain comes on during the exercise. If it hurts with every time, it's really hard to know how much to do. But if it seems like it's fine, but then it starts to hurt during any exercise, then you know you've hit the threshold of the tissue and you have to stop. So after you've worked your way through active range of motion, then you're going to do isometric. Isometric is where you're going to start to put some resistance against it. An isometric exercise is done to a count of 6 with a 4-second relax, and you're going to build up to 30 isometric exercises. Most people will start with 10 to see how their body reacts to it. So here Pat's inverting her foot against her hand, and she's counting 1, 2, 3, 4, 5, 6, and then relaxing for 4 seconds. And she's going to do 10 of these. 1, 2, 3, 4, 5, 6, and relax. And again, she's trying not to have the anterior tib come out, and she's also she's paying attention to the pain that she has, but she's introducing resistance. Now actually the one we're showing here is a little bit more complicated than the one, or a little bit more intense than the one that we're going to do on the floor now. So I'd probably have you start with this floor exercise. So what we do is use the other foot. So we're going to focus the exercise on the left as we've been doing. The other foot's going to be what you're going to push against for your isometric. And you're going to plantar flex your foot, invert your foot against the other foot, and then count to 6. 1, 2, 3, 4, 5, 6, and then relax for 4 seconds. And then 1, 2, 3, 4, 5, 6. You're in total control of how much to do. 1, 2, 3, 4, 5, 6. So I would do this one and then the one against gravity that we just demonstrated with Pat holding her hand. Again, we don't want the anterior tib to come out. Now, the next phase, if you're working through active range of motion, then isometrics, we're going to go to progressive resistant exercises. I've got the TheraBands here just to show you. Progressive resistant exercises, you're going to gradually build different, stronger and stronger resistance to that tendon, and this can take you 6 months to a year to go through. Here's the level 1 through 6 that we have our clinic. We actually have a level 7, which is a really black, almost like a bicycle inner tube. But these are sold all over under TheraBand, which is one of the company's progressive resistant exercise bands, or resistive exercise bands they're called. So here Pat is demonstrating the proper technique of doing it. We have just level 1 here, and she's going to take it's attached to an immovable object, so you can find your bedpost at home or a desk, but find some spot at home that you can leave this on. So we're going to do level 1. She wraps it around the front of her foot, plantar flexes her foot to get us in the right position, and then the rule of thumb is you're going to do first 2 sets of 10. She's doing the same technique. It's a plantar flexion inversion exercise, trying not to have the anterior tibial tendon come into effect. And the first set is sort of the warming effect. So you warm it up by doing 10, again going from neutral to inversion, and then she's going to put a little bit more tension on it to do the second set. So you want to fatigue it. Again, by the time you're doing TheraBands, you're doing it every other evening for sure. Again, you're icing after. Now you're really putting some good tone on it, and that will be difficult. So you go 2 sets of 10. When that gets easy, then you do a set of 15 and a set of 10. Then you do 2 sets of 15. Then do a set of 20 and a set of 15. Then 2 sets of 20. Then you do a set of 25 and 20. And then finally 2 sets of 25. Then you're ready to go to the next level. So once Pat had gone through all that, she will go to the next level. So now we're going to show single leg balancing. Now we're doing the functional exercises. So Pat, if you'd face me and balance on 1 foot, you can see this is. You start with the. I like people to do it in a doorway, so you can catch yourself. But this is going to. Functional exercises mean that you're not just isolating the posterior tib, but you're recruiting a lot of exercise. There's tons of these exercises. single leg balancing is one of the most common ones. So she's balancing on that first with her eyes open, and then she's eventually going to do it with her eyes closed. The goal is 2 minutes to be able to stand there and balance. See how hard that is. Then once it gets easy with eyes closed, then you open your eyes again and stand in the middle of a soft pillow. First eyes open, then eyes closed. Then you get one of those exercise discs that just lift you about a quarter of a inch off the ground, and you balance on that with your eyes open only. Okay. Then the last functional exercise to finish this video is 2 positional toe raises. They're called toe raises, calf raises, heel risers. So she's going to do her left foot. So you're going to off-weight the right foot, and then with the knees straight, she's going to gradually build up to doing 25 of these. So lift up your heel, Pat. Raise up on your heel. Yeah, and go up and down. So she's doing with her knee bent. So you want to do up to 25 with your knees straight first. So that's the easiest. You're using the big calf muscle to do this, and she's going up and down. After you've done to where the calf burns, even if you haven't accomplished 25, which can take you a long time to get up to 25. So I did this the other day, and I did 7 poorly. But then you bend your knee, and this is soleus work. So you bend your knee. You want to have your hip stay down level, and then you raise your heel off the ground, and try to keep your hip down while you go up and down with the knee bent. So this gets the soleus fibers of the calf. But this is also strengthening the posterior tib tendon, as it is the peroneal tendons. This completes our series of strengthening exercises that can take you a good year to work through. So good luck, and please feel free to, again, send me questions. My address is below, and feel free to comment on this video. Thank you very much.